Namaste. I'm Dr. Meenakshi, consultant family physician working at Apollo Noida and as a family physician and a public health specialist. Today, I would like to talk to you about malaria. Is it the beginning of an end in India? So, malaria is very important as it's a life-threatening disease which is caused by mosquitoes and by a parasite, Plasmodium, which has 5 species, and it is not spread via person to person. It is mild or it can be fatal, particularly in the age group of under 5, pregnant females, travelers, and people with HIV, AIDS, and severe infections, mainly predominantly in the tropical countries, and it is preventable and curative. So today, globally, according to WHO, in 2023, there were about 263 million malaria cases and about 5 to 6 lakhs malaria deaths in approximately 83 countries, particularly in the WHO African region where it is very common and a high burden of the disease. About 94% of the malaria cases in this region and leading to about 95% of deaths. Children under 5, about 76% of the malaria deaths are because of this, and particularly in the regions of Niger, Democratic Republic of Congo, Niger, and United Republic of Tanzania. Malaria is a public health problem even in India and Southeast Asia. So 95% of the population in our country resides in the malaria endemic regions, and 80% of the reported cases are confined to areas, and 20% reside in the hilly areas, the inaccessible areas, and the tribal areas. The National Vector Disease Control Program is by the Directorate, and which has technical guidelines and policies for various resources to the program also. So a lot of monitoring and surveillance is needed with collection and compilation of and onward submission of the data. There are passive surveillance centers through the peripheral health centers, the malaria clinics, the community health centers, and at various secondary and tertiary levels. So the ASHA workers, of course, have the rapid diagnostic tests and also have been given artemisinin combination therapy, the cases of the Plasmodium falciparum cases, which is one of the types of the Plasmodium species and posing a great threat. Another one posing great threat is Plasmodium vivax, but these are more common in the African and sub-Saharan region. The others species are Plasmodium knowlesi, ovale, and so this is not transmitted from person to person really, but it is by the bite of the Anopheles mosquito, and blood transfusion and contaminated needles might transmit the disease also. The symptoms could vary from mild to moderate to severe, and approximately the symptoms appear in about 10 to 15 days. So life-threatening cases happen in Plasmodium falciparum, and death occurs usually in 24 hours, so we have to be quick in diagnosis. Mild symptoms could be presented as in such of chills and headache. Severe could be seizures, confusion, difficulty breathing, extreme tiredness and fatigue, colored or blood in urine, impaired consciousness, yellowing of the skin, abnormal bleeding also. We need to diagnose it quickly and with the help of the diagnostic kits, and prevent it from becoming a severe illness. And of course, it becomes very important in pregnant females, which could affect the mother and also could affect the fetus in terms of low birth weight. So recognizing the symptoms becomes very important. Early diagnosis and treatment is going to prevent the disease, prevent deaths, and contribute also to reducing the transmission of the disease. So WHO recommendations of rapid diagnostic kits, which are parasite, also microscopic examination has been important. So multiple medication has been sought And the most common medications which are used are artemisinin combination therapy, and which is very effective in Plasmodium falciparum. Chloroquine is recommended in Plasmodium vivax and is still sensitive to the medicine. Chloroquine is added to patients with relapses of P. vivax and P. ovale, and also they can be mainly oral pills. Some injectables are also there, and the doctors base it on the type of malaria, whether the malaria is resistant, weight and age of the patient, and whether the person is pregnant. So prevention is with preventing the mosquito bites and by taking medication. And for travelers going to endemic regions. And transmission and the bites can be avoided with the use of mosquito nets in the sleeping areas, and which becoming very common. And mosquito repellents with DEET, IR 3535 and Icardia. Also use of coils and vaporizers, wear protective clothing, and also use of window screens. So just the vector control, which is very important, preventing infection and the transmission of the disease. These nets are used, which are insecticide treated, so they are called ITNs, and also indoor residual sprays are used so that the global burden of the disease is lessened. These are all WHO approved, and mainly the Anopheles stephensii, which is in challenge and in African areas more. So these are also resistant actually to the high temperatures, and also insecticide resistant. So it becomes a huge public health challenge. The chemoprophylaxis is usually given 2 to 3 weeks before the departure of the person from the destination, from the country, and till about 4 weeks after exposed to the malaria-prone region. So it's a huge and preventive therapy, and it also given to vulnerable populations which are more in particular areas as such. So there are malaria chemo prevention programs. There's a seasonal malaria chemo prevention, intermittent preventive treatment of malaria in pregnancy and in the school-age children, the IPT-SE, and the PDMC, which is the post-discharge malaria chemo prevention, and of course for mass drug administration. So these are all safe and cost-effective strategies implemented. And vaccines are also used since 2021. The WHO recommended RTS by AS01 malaria vaccine in children living in regions with moderate to high plasmodium transmission. Also in 2023, there's another one which is R21 by Matrix M. And this is throughout Africa. Various strategies and interventions by WHO recommended bed nets and chemoprophylaxis are being incorporated even in India. And although it is more common and anti-malarial drug resistance is more common in the greater Mekong sub-region, but we are trying to curb this in Africa as well, and through a Mekong malaria elimination program as well. There are various genetic mutations which have happened to the protein by the Plasmodium falciparum, which is the parasite, which is HRP2 and HRP3. So they become resistant, and these can be diagnosed by rapid diagnostic tests, and these can be, but some of them cannot be detected also. So there lies the challenge. So there are about in 2023, about 40 malaria endemic regions were identified for the first time by WHO. Elimination process has been ongoing, and there have been about 14 countries which have been malaria-free, including Maldives, Sri Lanka, Kyrgyzstan, Paraguay, Uzbekistan, Algeria, China, Argentina, El Salvador, Azerbaijan, Tajikistan, Belize, and Cabo Verde and Egypt. Malaria surveillance therefore becomes very important, and there's a lot of public-private partnership which has been maintained and which is helping us achieve our targets. So the WHO, of course, has a global technical strategy which is from 2016 to 2030, and working on the malaria endemic countries and trying to achieve the global targets of reducing the malaria case incidence by 90% by 2030, and malaria mortality rates 90% at least by 2030, and eliminating malaria as such in about 35 countries, also to prevent the resurgence of in the malaria-free zones. So a lot of global work is being done with the various malaria programs. Technical strategy for malaria. India is making a benchmark, and it is marching towards a malaria-free nation. 2024 was a landmark for us because from WHO, that it is away from the high burden to high impact group. So we have achieved with the help of the various programs running and a lot of reporting which has been done. So there's been over about a 97% reduction in the annual malaria cases from 7.5 crores at the time of independence to 20 lakhs by 2023, and the number of malaria deaths coming down from 8 lakhs to 83,000. So it is achieving zero malaria cases and reported from malaria free for about 122 districts, which is a very significant number, and reaching from about in 2015, 2023, dropped down by 80%. And so the cases are coming down from about 11 lakhs to about 2 lakhs in 2023. So, and the deaths falling from 384 to 83. So this has been a major achievement. They're celebrating this achievement, our program, and program being a part of this, reaching out to all the states in our country and reducing the incidence of the cases. So various significant surveillance efforts, including the rise in the annual blood examination rates, have helped us achieve this in early diagnosis, timely intervention, and effective treatment. So getting on to the malaria elimination. And this we are doing through the efforts of the integrated vector management as well, in terms of indoor residual spraying and long-lasting nets, and through the ECP program. So we hope to achieve this through the Ayushman Bharat as well, and with several trainings and achieving our targets and reaching our target of eliminating malaria by 2030. And I thank you very much for your patient hearing.